Wikidonist.com. Truth about tooth.
Today's topic is difference between braces and aligners. I've been contrasting a little bit of braces and aligners in the last videos also, but I'll come up with this one in very clarity. What are traditional braces? Braces are things that has been stuck onto the tooth so that we can have a handle on the tooth, and we used to use wires and elastics to move the teeth back. So that is how we used to move the teeth back, but now aligners have come. What difference does it make? The difference is that the aligners are much more see-through. Although we had ceramic braces which are clearer and much more aesthetic, or even lingual braces which were actually worn inside the tooth so that it is not visible at all. But the problem was actually the talking was used to get affected because the tongue used to interfere into that, and we could not do large cases or very big cases with or tougher cases with lingual braces. So that is where the aligners have come in, and the aligners have actually revolutionized the aesthetic part of orthodontics. Now, what are the differences? What does it make for an aligner and a braces? In the braces treatment, you have to come at least once in 3 months to the dentist. It is much better. Most of the time the dentist will call you for a monthly checkup and review. But in aligners, we can actually increase the checkup and review numbers, or even up to, in some cases, we can actually give it to an international patient and give it to them so that they will wear it in right time and this thing, and we can actually monitor it using a WhatsApp or a online platform, and we can actually do it. So there are a lot of cases which has been treated from India with me, and they are in Italy. There are some people are there in UAE, some are in Australia and things like that. So that is actually the greatest thing, because braces could not be worn here and then it could not be got adjusted or anything. So they'll have to come down and things like that. So that way, most of the Indians, especially the NRIs, have actually taken up aligners as their treatment of choice, because they can wear it wherever they take, and then they can come after 1 year or 1.5 years of treatment. They can come back and then get the final retention protocol done here in India itself. So that means that they are saving a lot of money, because most of the time braces treatments are very costly abroad, and in India the braces treatment is actually even more cheaper. But aligner could be a good choice for those people who are doing braces abroad, because aligner therapy in India is actually at par or even lesser than the braces costs in Europe or in US or even in UAE. So people are opting out for dental treatment in India, the aligner treatment in India, than braces in another country. And the second part to it is actually, we can actually see how the teeth moves in each and every step with an aligner, which is not possible with braces, because we could not do we can do a computer modeling and things like that, but even if you do, it will not follow that way, because the braces, with the braces we are actually moving it with elastics and wires, and according to what each orthodontist does on each appointment, that is how it moves. Although it is already planned, but still it is a human hand which does. But in an aligner, each and every step is actually planned by a computer. So the orthodontist will actually plan the treatment, and then the plan is actually given to the computer, and the computer plans and designs the models, and that model has been actually been used to make the aligner. So there is an orthodontic part to it, wherein just like doing braces, we'll have to do the diagnosis, we'll have to do the plan, we'll have to plan how many millimeters of teeth has to be moved, how many millimeters of teeth has to be taken out. All these things are done by the orthodontist itself. So the braces, the first part of braces has to be done with the orthodontist. The second part of fixing the brackets and things like that is not done. So at that time it goes to the company, the planning is done in the company also, the movement is being planned, and then the aligner comes in. In the aligners, we might have some attachments on the tooth, which is actually tooth colored, and it is just a small dot on the tooth. So that has to be worn so that the aligner gets a much better grip. It also acts like a small handle for the aligner to work on, but it is not as big as your normal traditional braces, and it is much more aesthetic also. So you don't have to worry about attachment. There are some videos on the YouTube saying that there are still attachment on the tooth. It's not very clean. In some cases only we need attachments. We don't need attachments in most of these cases. There are some cases wherein we need to give specific attachments to get a movement on the tooth itself. So that is also very aesthetic, so it doesn't show to anybody and anybody who is there around you, like your colleague or anybody, but you can still feel there is a small bump on the tooth or something like that. So that is what is about attachments. Now the fourth and the final thing is actually the aesthetics. Aesthetics because of 2 or 3 things. If you go to if you wear the braces and you go and have some food, the food will all be stuck all around the place. So that is one reason why people don't like braces, because the food will get stuck. They go to an official meeting, they go to school, and then they eat something and the food gets stuck everywhere. So they'll have to go and wash and things like that. In case of aligners, you don't have to bother about it. You can just take out your aligners and you can just have your food. So there is no food getting in between and things like that. That is one reason why it is much more aesthetic. Second thing is, in the case of braces, you have a metal or a ceramic stuck on top of your tooth. In the case of aligners, there is nothing like that. It is a removable thing. Second thing is, it's actually very transparent, so you can still smile and walk around, even have a photo shoot or a video shoot without any trouble. So all these things gives you the extra edge of aesthetics. The one more thing which is actually very good is actually the brushing is made much more easier. The brushing is very difficult in braces. If you have worn the braces for some time, you know how difficult it is to brush, and we have restrictions on food, like harder foods cannot be eaten while you have braces, but whereas in aligners you can remove the aligner and just have your whatever Coke or whatever food you would like to have, because it doesn't affect the aligner at all, because just remove it, put the whatever you want to have, and you can have a cracker, you can have a Coke or something like that with aligners. But with braces we should avoid all those things, so that is also made aligners much more of a choice even in younger children, because they can eat the chicken and the leg and things like that. So all those has made actually aligners much better. But the bad thing about is aligners are still costlier than braces. So hope that the aligner companies will come up with technology to reduce the costs. At present, braces is still being done, aligners are also done. They both are very good treatment plans, but it is not better than one or the other, except for aesthetics and keeping your food out of your this thing. But the cost makes it a little more. The braces is still lesser costlier than the aligners, but hope aligners also will come a little more cheaper, and we will be able to do it for the masses also. So thank you very much for listening. We will come up with aligner topic next week also, so please understand and subscribe my channel so that you will understand more about aligners and other dental treatments. Please watch my videos which are there about most of the dental treatment plans and things like that. Thank you for the subscriptions. Thank you for the comments. Please make sure that you comment if you have some queries about this, and if it is a worthwhile topic, I will be speaking about it. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive.
Wikidonus.com